And we are going to begin until we get a quorum as a subcommittee. And our first presenter is a member of our committee, Senator Cox, with SBX 841.
All right. As opposed to the podium?
It would be fine, Senator Cox.
All right. Are you ready for me to begin, ma'am?
Yes.
Thank you. Madam Chair and members, thank you for the opportunity to appear before you today. I have put forward legislation in the 8th extraordinary session, which is called SB 8X41. This legislation that we're proposing is intended to redirect and maximize the Proposition 10 tobacco taxes that were approved by the voters in 1998. Madam Chair, I may take just a couple minutes longer this afternoon to be certain to paint the entire picture for you. You may recall that I worked across the aisle last year to advance AB 1422. 1422 was a bill that was signed into law. That bill helped families shore up the California Healthy Families Program. It did so in part with Proposition 10 or first $5. Just as passing AB 1422 was the right thing to do, we also need to recognize that we need to take steps to prioritize the $600 million revenue stream that is Proposition 10. I have provided a list of 7 grants that were approved just 3 weeks ago in Sacramento County, because we have been talking about what we believe to be the grants that don't make a lot of sense, even going back to day one. You will note there that Sacramento County Running Start with Kids, a more united community, got $5,000 for 17 kids, 0 to 5. This is a group that has a twice-a-week play group with arts and crafts. And then down in Florin, they have a Kids Comfort Zone play group. And the Florin moms play twice monthly play groups to connect families with young children.
Senator Cox, if I may interrupt for one moment, we have a quorum.
Yes, ma'am.
If we could take that roll call, please.
Alquist.
Here.
Alquist here. Strickland. Honested. Cedillo. Cox.
Here.
Cox here. Leno. Negretti McLeod. Leno here. Negretti McLeod here. Pavley. Romero. Romero here.
Thank you, and we welcome Senator Romero.
Thank you.
And on the second page, you will find that there's the Elk Grove Spanish-English Creative Arts Playgroup. This is a first-year playgroup down in the Elk Grove region. This playgroup will do art and other activities with Spanish-English language, focus at bi-monthly meetings. Reading, art, and music will also be cross-cultural. Each meeting will include circle time and hands-on arts activity. That was for $4,140, 5 kids. You'll see down in the Alder Grove community, $5,000 grant. My community, Emma and Me and Family weekly play group, they got $4,900 for 68 kids. Then you take a look at Community Keepers, which has to do with the South Sacramento, wants to continue early literacy efforts with monthly evening reading circles. And then there's another one there for $37.75 called the Thomas Neighborhoods. It seems to me, Madam Chair and members, that we can no longer explain or justify using tax resources for play groups or circle times and movie nights not when dollars could be used to fund health insurance and direct health-related services, and that's frankly, what I'm talking about. I have previously shared with you, by the way, the press accounts of yoga classes, Italian immersion programs, couples getaways, belly dancing, and other things, retreats up and down the state, across the state. In San Diego, Senator Kehoe and I have asked the district attorney to investigate conflict of interest issues. And in an interview last year, San Diego County Supervisor Diane Jacobs said the commission has not received as much attention from county officials as it should. Jacobs said that she began making changes and noted that longtime executive director Laura Spiegel resigned. And Ms. Jacobs then said it's time for a complete house cleaning within the organization. If you go up into farther up in San Diego, you'll find that Ron Roberts is the supervisor, and he had singled out First 5 San Diego as he and his colleagues sliced 771 positions from the county workforce and a handful of programs that help poor children. He said that he was shocked to find that the First 5 Commission of San Diego County had more than $200 million in the bank. He seemed to go on, and when he went on, he said, you know, this is not a prudent reserve, this is a sinful reserve. And he said there's something seriously wrong with the organization. Then if you go up farther, you'll find that Marion Ashley said that he didn't want to serve on the commission anymore, on this 9-member commission. He said it was just automatically set up to be dysfunctional. So now let me set up for you the 4 fundamental proposals of aspects of this proposal. First of all, this proposal, which would have to be taken before the people of the state of California, this proposal is designed to cover California's kids. It commits future Proposition 10 revenues to the state's general fund for California's Healthy Family Program and Medi-Cal. The annual revenue stream from Proposition 10 is approximately $580 million. California's general fund expenditures for healthy families was budgeted at $425 million. Federal funding for healthy families is generally provided with a 2-to-1 federal-state matching ratio. Madam Chair and members, there are probably an additional 200,000 kids in the state of California that were eligible but have not yet been enrolled in healthy families. Excuse me. We believe that number has grown. Enrolling these children would require about $84 million from the general fund. The ongoing revenues from Proposition 10 would allow California to cover more eligible children. And members, the second aspect of this proposal is that it blows up boxes and banishes bureaucracy. This proposal, if placed on the ballot by the legislature and approved by the voters of the state of California, would eliminate 58 county children and families First 5 commissions and the state's Children and Family Commission. 59 bureaucracies and their associated overhead costs would be eliminated, thus increasing the funds available for children's health care. The third important aspect of this bill is that it will provide significant fiscal relief for local schools and local governments. Now, we have passed out for you a chart that shows how this money would in fact be directed. This proposal would direct all unencumbered funds at the date of passage by the people of the state of California, the 58 county commissions to schools and local governments. You can see that's on the right-hand side there. The proposal does this by directing 50% of all funds unencumbered as of the date this mandate is approved by the voters to the school districts in each of the respective counties. The remaining 50% of all funds would go to the counties and to the cities within each county. distribution for the local government funding would provide for 50% of the fund balances to go to each respective county, and 50% of fund balances to be divided on a per capita basis to each city within the respective county. Members, in June 30th, 2007, the audited financial statements of the 58 county commissions showed a combined reserve balance of $2.79 billion. $2.79 billion. The fourth important aspect to this proposal is that it provides significant state general fund relief. This fund would direct all unencumbered funds from the state's first 5 commission be directed to the general fund for deficit reduction. Members, it pains me to tell you that we've had 11 years of experience with Proposition 10 and the first 5 commission. During that 11 years, you will note that the first 5 commission has faced a great deal of criticism. There have been 2 state audits that were condemning in nature, multiple grand jury reports, numerous media and editorial criticism, and then one news story recently found in the Chronicle was titled, "Not All First 5 Grants Are Helping Poor Kids." I honest to goodness don't believe that the voters had Italian immersion programs for the fairly well-off in mind when they voted for this in 1998. Nor do I think the voters thought that they would be paying for hotel stays and $250 Target gift cards for people participating in San Francisco's first 5 couples travel and learn together grant program. Certainly, play groups and singing or musical circles are not the highest priority uses for taxpayer dollars. I think it would be fair to say that health coverage should be a higher priority than music circles. I would note that the governor's budget proposal includes a proposal to redirect some Proposition 10 funding. I rather suspect because we had participated last year and the year before relative to Proposition 10 that which first 5 commission did for the governor last year was in large measure because we had, for all intents and purposes, exposed the operation. I believe that the measure that I have proposed is a preferred alternative as it provides funding and solves the ongoing problems with Proposition 10 and first 5. I would be happy to answer any questions that you might have. I'm relatively certain that you will find that there's some opposition to this. I simply ask you to follow the money. And where you follow the money, you will find the people who are opposed to this particular program. Yes, ma'am.
I was going to say thank you.
Yes, ma'am. I am done.
Thank you,
Not
Senator
finished,
Cox.
but I am done.
Okay. What we will do now is first go to support and then opposition, and both for support and opposition for each category, it will be 2 people, 3 minutes each, or some variation to get to the 6 minutes. So first, and then we'll go to the committee. Is there support? I don't see support. Is there opposition? I don't. Oh, if there's opposition, please come up.
Good afternoon.
Good afternoon. Is it on?
I think it is now. Yes, thanks, Madam Chair and members. Well, gosh, I had a quick 3 minutes, but I have quite a few things I'd like to just respond to that I think are rather troubling and misleading. I'm Sherry Novick. I'm with the First 5 Association of California. I represent the 58 county First 5 commissions. I want to say, first of all, that while we very much appreciate Senator Cox's support of the Healthy Families Program and Medi-Cal and his desire to make sure that all children in the state are covered by health insurance, we would submit that this is actually not the most effective way to do that because it involves such huge takeaways. The orange sheet that I passed out to you is similar. Some of you may have seen something very similar in the Senate Budget Committee. This is slightly updated. We got a couple more small counties numbers included here. But this gives you an overall sense of where, in fact, the dollars are going. I won't walk through it with you because of the time limitation, but I think that what's important to remember is that when you've got 58 local commissions all making their decisions locally based on local needs, that you are going to end up with quite a variety of activities. However, they can very easily be disparaged if one does not understand child development and early brain development. It so happens that the single most important indicator of a child's success in school is the number of vocabulary words he or she has been exposed to by the time he or she enters kindergarten. Well, how do we get parents who were not read to as children themselves, who were not raised knowing positive discipline strategies? How do we get them to alter their behavior? And how do we start introducing language to those children in low-income communities where their houses may not even have any books? We do it by engaging them at the community level frequently in things like reading circles and play groups. You know, family isolation is the single largest factor in child abuse. When a family is isolated and no one knows what's going on in that family, children can be endangered. That's why community-level projects like play groups or circle times are a critical element in engaging families who would not normally come forward for assistance. So I just think it's important when we pull out these little names of little mini grants and disparage them, that we understand what's behind them. And I know that First 5 Sacramento would be very happy to sit down with Senator Cox and explain really what's behind each of those proposals. And just as an example, I'll tell you, the yoga classes and the belly dancing classes get thrown around frequently. The belly dancing classes that Senator Cox started talking about 3 years ago were a small component of a program for teen pregnant moms, high-risk pregnant moms. First 5 San Diego at that point, invested in the nutrition and physical activity component of that program. Belly dancing was one of a number of physical activities that kept the kids
You've
involved.
had 3 minutes.
Okay.
One last sentence or thought?
Okay, so my last sentence would be that I hope that if any of the members have questions about these sorts of programs, please to let us know so that we can answer them. And I would also just say that when Senator Cox introduced this bill several years ago, he said he just wanted the voters to have a chance to reconsider how these funds are used, and they did have that chance last May. They had that chance when they voted in 1988. In the year 2000, they voted again to reject a repeal of it, and they voted last May. So I would submit the voters have had a chance. Thank you.
Thank you. Next witness.
Hello, my name is Roy Alexander. I'm the Chief Executive Officer of the Sacramento Children's Home. I'd like to recognize that Senator Cox has been a longtime friend of the Sacramento Children's Home. As you know, SBX 841 before you this afternoon attempts to divert all tobacco tax revenues raised under Prop 10 to the State General Fund to be used for health services. This is contrary to the purpose for which California voters enacted Prop 10 and a direct affront to local government and local decision-making. Prop 10 was designed to address the needs of the whole child during the most critical development years of 0 to 5, and it does through a rigorous local process of needs assessment, strategic planning, and a very open, community-involved process. As you may be aware, First 5 Sacramento has just this year made a number of funding decisions to help our county and our children through very difficult budget times. Sacramento County Child Protective Services has experienced a cut of 250 positions, with an additional 50 being considered this week. First 5 Commission expeditiously responded to the significant cuts by providing crucial safety net services like clearance exams, medical exams for children that are removed due to severe neglect and abuse. These exams are crucial because it's the first time that the child is examined for any kind of health concerns, as well as many times when a neglect complaint is filed, subsequent sexual abuse is identified through these clearance exams. They funded early intervention prevention programs that lost their funding, like Birth and Beyond home visitation program and our crisis nurseries programs. Our crisis nurseries program are a very crucial safety net issue in that we reach families very early on when they are first in crisis, where the children are most at risk of being neglected. By defunding First Five, this bill will eliminate a range of services that are integral to the children's health and development. Home visiting to very high-risk, isolated families, developmental screenings, early intervention, oral health, family literacy programs, anti-obesity efforts, preschool and training programs, and school readiness programs. In Sacramento County, we've invested First Five funds in fluoridation of local water systems, one of the most effective oral health strategies for young children. When the voters approved Prop 10, not once but 3 times, they voted for local flexibility to meet local needs. As the CEO of the Sacramento Children's Home and the chair of the Child Protective Services Oversight Committee, I can attest to the value of this type of funding and the harm that would be done if it should suddenly disappear.
Your timing is perfect.
I urge you to vote no on the bill.
Thank you very much. Other witnesses, that they would say their name and position.
Thank you, Madam Chair. Dawn Kepke with McHugh and Associates on behalf of the Child Abuse Prevention Center, and we are opposed to the bill. Thank you.
Thank you. Anyone else in support, please come forward quickly.
My name is Farah McDade Ting for the California State Association of Counties in opposition to the bill.
Thank you. I would like to make some opening comments, and then whoever else would like to speak. First thing I would like to say that I think we need to understand is what is First Five supposed to do? What is its purpose? It was created to have a coordinated, integrated, and comprehensive statewide program that supports early childhood development services from prenatal stage to 5 years of age. And I think it's key for us to understand that. The second point I would like to say is that I believe that for the most part, First Five, the counties use the money well. I think there are some cases where they do not use the money well, and that there needs to be a stronger sense of accountability. And given all of that, I would like to say I think that this complete proposed elimination of Prop 10 programs, as proposed by this bill, goes way too far. And it was just last May that the voters, 2-1, soundly voted not to take this approach. And I am interested in what my voters say. Senator Cox has done a great job of bringing to our attention some of the incidents that have occurred amongst the various county commissions. And Senator Cox, I want to thank you for doing that. You've been persistent, and I think you have made your points real clear, and I do think there should be a greater sense of accountability. Having said that, I would like to share with you what I just received the other day from my First Five Commission in Santa Clara County, as written and relayed by Kathleen King, Mayor of the City of Saratoga. Kathleen is also the Executive Director of the Santa Clara Family Health Plan. And she says, without First Five, we could not run the Healthy Kids program. We just would not be able to raise the funding to support the 8,500 children that receive medical, dental, and health coverage in our county through this program each and every year. Before the program started, 1 out of 8 children in Santa Clara County did not have health coverage. Since the inception of this program, over 97% of our county children now have health coverage. First Five knows how to help leverage their funding into more funding, helping with outreach to programs, leveraging other foundations, and reaching out to partners. I'm sure that I have some colleagues who would may wish to share some of their experiences with their counties, but this is the reason why I would not be able to support the bill today. Is there anyone else who would like to speak? Senator Leno.
Thank you, Madam Chair. Please put me on record as siding with two-thirds of California voters in support of sustaining Prop 10 for all the reasons that have already been stated. You know, it was 1997, just prior to the enactment of Prop 10 in 1998, that a White House conference on early childhood development and learning underscored that in attending to the educational development of young children, that we also have to deal with their physical and social, emotional, and other aspects of their development. And I think that if we're really serious about addressing the achievement gap in schools, in keeping kids in school, which in and of itself will lower crime rates, lower abuse of alcohol and drugs, and will lower our prison population. All of these dots connect. There are enormous benefits to the investment that the voters have repeatedly said they want to see put into Prop 10. So I think, Madam Chair, you were appropriate in thanking Senator Cox for his attention to any abuses to be found in the system. Clearly, we're not going to create a multi-billion-dollar program and not see some problems that need to be addressed. And after the first audit in 2004, it was then Assemblywoman Chan who addressed some of the concerns brought forth by that audit and expanded and clarified auditing and public hearing requirements in the Prop 10 program, and that's all to the good. So I think we need to encourage you, Senator Cox, and everybody else who's concerned about making sure we spend our dollars most effectively to keep an eye on the program. But I also have to say that we couldn't have a more earnest and committed director than we do in Sherry Novick. She does such a great job, and these are very committed people throughout the state in each of the commissions in each of our counties. So I also will not be able to support the bill, but think that we need to be vigilant to make sure that our dollars are spent most effectively, not only for the fiduciary responsibility we have to taxpayers, but also for the sake of the kids that are who were meant to benefit from these dollars.
Is there anyone else who would like to speak from the committee? Senator Romero and then Senator Negrete-McLeod.
I imagine this has also been articulated. I know, Senator Cox, you have been a champion for looking for alternative ways that we can try to figure out the budget crisis and how we can invest more dollars in health. But the one issue that especially persuades me that at this time this is not the best vehicle is that we've heard from the voters very recently, in fact, and so that is the strongest message back to me. So I will not support the bill today. I know that you've tried to figure out ways in which we can get more money into the healthcare system. I applaud it. I think we all need to do that. But we just heard a few months ago the voters saying no, and that's the part of me that I heard in a very resounding way. I think that you're absolutely right. There are ways in which we can try to encourage the local commissions to rethink the kinds of programs that they are doing and maybe try to focus much more so on what we might consider to be more direct health related. But this response today, in light of the voters' responses, to me would not be the way to go.
Senator Negrete-McLeod.
Well, I will not be able to support the bill today from my esteemed colleague. I do want to thank him so much for bringing this to the fore continuously year after year. And I also would like to say that perhaps because of his tenaciousness of bringing the bill forward, that it has made some of the counties look at what they're doing with this money. And I don't care what the voters say. I don't think anybody should have this big of a reserve anywhere. I mean, it's prudent to have a reserve, but to have as much money as they do really has to be examined. So.
close?
Of course.
Thank you, ma'am.
And Senator Onestad has moved the bill.
Let me just close with, I want to give you some numbers. And thank you very much. I can count. We could do this 4, 5, 6, 7 times, but we'll probably come up with the same count each time. I understand that part. Let me just comment about the aspect of the Italian immersion in San Francisco. There was no income evaluation. It just didn't occur. There were no limits. And you talk about the voter having spoken, that was Proposition 1D. But Proposition 1D had no reforms in it. It just moved the money around. And for me to sit here and think that the crisis nursery has to wait in line with circle groups just creates a real problem in terms of prioritization in my mind. One of the supervisors in the South said, sinful reserve. Well, let me just tell you, Sacramento County in 07 had a balance of $100 million. In 08, they had a balance of $104 million. Reserve, unencumbered. And when you take a look at January 8, 2008 population numbers, Los Angeles County had 10.3 million, unincorporated 1.1 million. The incorporated is 9.2. City of Los Angeles is 4 million, or 43% of the incorporated population. LA First 5's unencumbered fund balance as of June 2008 audited financial statement was $377 million. Actually, 377.5. Under our proposal, the school district in Los Angeles County, mistake I made was I should have brought Mayor Villaraigosa up, because they would get $188.7 million. Los Angeles County would get their share. That's just the school district would get the 188. Los Angeles County would get 94.3. The incorporated cities would get 94.3. The city of Los Angeles would get a total of 43.415. And members, I can bring this bill back next year or the year after, whatever the rules say, but things are not going to change. And the reason they're not going to change is because the members of the First Five Commission know that the California legislature is not going to pay any attention to what they do. And so as a result, you get exactly the same thing that we have now, except that, you know, I'm just so damn stubborn, I'm not going to quit on this. Thank you very much, Madam Chair. Ask for an aye vote.
I've promised not to prolong this too much,
Yes.
but the California legislature, Senator Cox and I believe we all voted for it, supported Assemblywoman Chan in her efforts to address the very concerns that the 2004 audit brought to light. I would think if there are further fixes to be made, that would be a great place to invest energies. That if there are bills that could be designed that would address further issues revealed through the subsequent audit, that would be a great thing for us to do. But I think we're spinning wheels if we think we're going to attempt to overturn what 2/3 of voters have now twice said they support.
Well, Senator Leno, I know this is not ping pong, so this isn't trying to rebut this. It's just simply a situation that the last time we voted, Proposition 1D didn't have any reforms in it. It was just simply moving money around. No one spent any money except the commission spending some money. So it is a situation where I'm pretty passionate about this at this particular point. I appreciate your recommendation. And next week, next month, next year, that may be the way to go. But today, I'm simply saying to you that the California legislature has sent a message that says we're not going to pay any attention to what you're doing.
Well, we are going to pay attention, and we are going to take the vote now.
All right, ma'am. Thank you.
Thank you.
Alquist,
Aye. I mean, no.
I think you want to be no.
I'm dyslexic, and I meant I to not doing it. I'm sorry. That was a no.
May I just say before you get farther down the line, I do really believe that what needs to occur here is it needs to be an all-Chris-Cox bill, and we'd get this baby out. I'll tell you that.
Well, we should talk about accountability in this because we all care about that, and would love to talk with you, Senator Cox. And yes, that was a no. Thanks.
Alquist, no. Strickland, Onnested? Onnested, aye. Cedillo? No. Cedillo, no. Cox?
Aye.
Cox, aye. Leno? No. Leno, no. Negretti, McLeod? Pavley? No. Pavley, no. Romero? No. Romero, no. 2-5.
That vote is 2-5. The bill was defeated. Thank you, Senator Cox.
Ayes have it, I presume.
Next, we have Senator Huff. Item 2, SBX 865. Welcome.
Thank you, Madam Chair. Well, here we are. It's no secret that the ongoing recession has created a strain on jobs, and that's the reason we're here. In December of last year, the state had a 12.4% unemployment rate. In some counties, it's much, much higher, some double that amount. New York Times wrote an extensive report estimating that even with the recovery, many jobs would not return. Declining tax revenues have forced seemingly endless debates over the size of state government, the breadth of taxpayer-funded services we should provide, but the bottom line is we have to stimulate the private sector to provide those tax dollars that provides the revenues we need for all the services that we hold dear, whatever they are. These jobs are inextricably connected to health insurance in California. Cost of benefits, including health care, are integral to the cost of hiring employees in the state. 59% of Californians receive their coverage through their employer. Sadly, too many employers are struggling to pay those costs, and more dollars are going to pay for unnecessarily high insurance premiums instead of new jobs. According to a recent study by the RAND Corporation, excess growth in health care costs has adverse effects on employment, output, and added value to GDP in the United States. Here in California, health insurance is such a heavily regulated market that it artificially inflates prices and reduces choice for consumers and businesses. In fact, California has 56 mandates on the health insurance industry, requiring them to cover some benefits under their plans, whether the consumer needs them or not. By contrast, Alabama has 21, Idaho 13 mandates. In the end, these mandates are passed on to the consumer along with their costs. In most cases in California, this is the employer shouldering those costs. Every time California artificially inflates health insurance premiums by creating a new mandate on regulation, it is levying an indirect tax on employers. So SB 65 will give relief to the employers purchasing health care. It's incremental. It's not full relief, obviously, but it opens up the market to them and gives them an option to buy more effective health insurance products in other states. Opening the American market to Californians will significantly expand the health insurance products available to employers and foster healthy competition among those providers. We should let employers, and for those that are self-employed as consumers themselves, decide what health insurance plan is right for them and reduce their costs by avoiding red tape and expensive state mandates. By giving employers this option, we will allow them to make more efficient decisions that are more cost-effective for their needs, help them keep their doors open, help them keep hiring people that are paying those taxes that are funding the services we want. I respectfully ask for your aye vote.
Thank you. Witnesses in support. 2 witnesses, 3 minutes each.
Yes, thank you, Madam Chairwoman. Michael Shaw, National Federation of Independent Business. We're happy to be here in support of SB 65. We believe that competition is one of the critical elements that will help bring down and control costs within California's healthcare system. For small businesses, more than the general population of private employers and providing health insurance, this struggle is very critical. Our surveys over the past several years have shown, as has been, I think, the general trend, a declining number of businesses being able to provide insurance to their employees. But that number is far lower in the small business environment than it is generally speaking. In fact, fewer than half, probably around 40% of members, as of last survey we had done, were providing health insurance to their employees, not because they think it's too nice, too expensive, or I mean, they think that it is too expensive, not that they think it's something unworthy of providing. And that's really the critical issue, is you have people, men and women, who are working every single day to provide jobs for Californians, who want to do the right thing, who want to provide health insurance to their employees because they know that this is a benefit to the employee, but also benefits back to the employer. And to that point, they want to be able to do this. We believe that opening up the national market to Californians, small businesses seeking to provide that health insurance to their employees, that competition, that additional supply will help bring down and control those costs. California does have a high number of mandates relative to other states in the country. This is not something that we think is unique in the health insurance market, but certainly an area in which we could take action today that would help Californians right now. And that is, I think, something this legislature is certainly very interested in doing, and something that our members, the 20-plus thousand small business owners in the state of California, over 350,000 nationwide, would love to see us do. Thank you.
Madam Chair, Member Stephen Lindsay with the California Association of Health Underwriters. I represent brokers and agents who sell health insurance and employee benefits to employers. The trade association I represent currently has a neutral position on this bill. We do have some concerns. We appreciate the author's willingness to bring this bill to start the conversation, given that it's contained in every piece of federal legislation that has been suggested by President Obama or has moved through the Senate or the House of Representatives. So it is an idea that has gained some traction. We think, however, there are many, many, many complexities about doing that. California is arguably the most competitive state in the nation when it comes to health insurance. Our health insurance premiums have been lower than the rest of the nation for the last 20 years, and that is because of our competitive marketplace. When we did small group reform in 1992, we created a level playing field and a system that's not represented in any other state in the nation. And it has served us well. So we find ourselves somewhat reluctant to fix what is not broken. On the other hand, we watch our employers struggle to make premium payments. We watch individuals struggle to make premium payments. And the thought of being able to reduce their payments by 10% is very attractive. So we're not sure at this point whether the gain we would get if this bill were to pass would offset the losses. But we do think we need to continue the conversation, as it looks like it has gained some kind of traction on a federal level. We would not, however, be in support of it. It was a California-only bill. It would only have to be in context of a national reform, so there would at least be some minimal foundation of rules that everybody had to follow. Thank you.
Madam Chair, could I ask a question, please? I just want to make sure I heard you correctly, that because of California's competitive market, we have lower rates of coverage costs than other states.
We have historically. The last 3 to 4 years, we have been gaining. So we may, in some PPO products, actually cost more today than we did prior to that. But prior to that, we've always been somewhere between 3 and 7 or 8% less than the rest of the nation.
Okay. Did I hear Senator Huff incorrectly that we're paying much more in this state because we're so overregulated?
Well, you know, California is an interesting market.
Did I mishear you?
I don't recall what I said, but I can tell you it would still be, it's estimated to save costs, so any money you're leaving on the table or taking out of employers' bottom line is money that can't be spent on hiring people.
So then I have a question for the underwriters. Wouldn't your members, if Senator Huff's bill were to be enacted, who are currently domiciled in California, if they could still keep their California market, but do business from an out-of-state location, because some of these other states have so many fewer regulations, as Senator Huff has suggested, there'd be no reason to stay in California. You could have your mark in California and go to a state that has many fewer consumer protections, and you could save some money by stationing yourself out of state. So this is really a job killer bill. Jobs would leave California.
The logic behind your statements, I believe, are accurate. We still do have some California domiciled companies that only sell insurance here in the state of California. And while we want to see a more competitive marketplace, I'm not sure we're willing to risk locating in Nevada in order to sell more business in California if it's not business that gets on the books, stays on the books, and it fits our clients' needs. And so the concerns that we have in large part have to do with what benefit mandates are not available in those other states that are here and our clients like. Not all benefit mandates are bad benefit mandates. Not all consumer protections are bad consumer protections. We have created a sense of expectation from the folks from California about the kind of coverage that is available in this state. And part of that has been the process in the legislature that has implemented those 50-some-odd mandates. We think there are a number of those that could be eliminated that would help reduce the cost. However, as I said before, this is a balancing act for us, and I'm not sure which side of the coin my trade association will come down on.
And then just lastly, and I know we want to get to the opposition, which may bring up some of these points as well, but since you were here, I thought I'd ask you, wouldn't there also be an incentive for a race to the bottom? Because if these other states, which have fewer regulations, fewer requirements on providers, carriers, then they're going to be able to sell in your market here in California, and they're going to be more affordable, and cost is becoming everything at this point. People are buying ridiculously poor policies because it's all they can afford. It's going to be a race to the bottom.
I think there is a potential for that. Having been in the business for 25 years, I continually watch my clients buy products that I can sell them a similar product for less money, but because it has their doctors, it has the drugs that they take on that product. It's in some cases it's a local product. For example, like Western Health Advantage here in Sacramento, some folks have a loyalty because it's here. So there are a whole variety of reasons that people purchase coverage. However, I think as time goes and as premium increases, it is harder and harder for them to not focus only on price.
Okay.
Thank you. And before the opposition comes up, I would say we've had one in support, and then we had Mr. Lindsay, who's neutral, who might only be supportive of the state bill if it doesn't become a state law, but if it becomes a federal law. Okay.
Which doesn't sound like full support, but may I respond on a couple of the points that were raised?
Go ahead.
Thank you. As for it being a job-killing bill that Senator Leno had suggested, I would say, first of all, that there has to be, having made my living for years in sales, there has to be a physical presence to be effective. I mean, you can do internet sales, I'm sure, but if you're going to be effective in it, there's going to be a personal presence. And so I don't think it's going to erode the number of California jobs from that standpoint. Having said that, not all jobs are created equal. We could put everybody on the state payroll and not have a way to afford it. So just creating jobs for the sake of creating jobs, I'm taking an extreme to make a point. It takes estimated 25 to 27 public or private sector jobs to support one public sector jobs, because you have tax revenues that are going off to pay full percentage of that salary. So not all jobs are created equal. And likewise, when you have jobs that are hired by the private sector and they have that whole multiplier effect in the jobs market, that multiplier effect, part of it goes through buying insurance, buying Sparkletts water, buying whatever, but it all comes into the cost of doing business. And so when you heap that camel too heavy with one extra straw and it collapses, you get zero jobs being generated of that. So simple math doesn't work on jobs, and I know you know that as well, but just to simply say this could be a job-killing bill because the insurance industry might be outsourcing some of their jobs to another state, I don't think it really is an apples and oranges comparison. As to the race to the bottom, let's keep in mind that federal law already preempts this through ERISA. And if, we have 50 to 60% of the insurance being covered through that already, that's regulated by that. Now, I don't hear anybody hollering about that. In particular, Safeway is one that's regulated by that, yet it's one of the largest health care providers in the state. So, to say that somehow this is a race to the bottom, I don't think that really holds up to analysis either. Thank you.
Thank you, Senator Huff. Opposition, please.
Beth Capel for Health Access California, here in opposition to this measure. We have a few points that we'd like to make. With respect to the
In 3 minutes each.
Yes, ma'am. With respect to the existing protections that Californians have, we wonder exactly which benefits that these gentlemen would suggest that we repeal. Pap smears, mammograms, childhood immunizations, diabetes supplies, prostate cancer screening. Are these the excessive benefit mandates that California has? Which consumer protections would they suggest that we repeal? The right to a second opinion, the right to have an independent medical review, the right to a financially solvent insurer. These are basic protections that have been in California law now for many years. The right to mental health parity, we would concur, increased premiums very slightly. However, previously, private insurers had been shifting the cost to the taxpayers who, through our mental health spending, had picked up those costs. With respect to the discussion about whether this is a job killer or not, we are very mindful that many Californians today find themselves underinsured and that foreclosures and medical bankruptcy are closely correlated with inadequate health insurance, and this would only make that problem worse. We are also mindful that the healthcare industry is one of the largest employers in California, and that to the extent that we don't have people getting pap smears and mammograms and adequate diabetes care, there will be fewer people providing it as well. And with respect to the assertion that federal health reform includes this, indeed it does not. What federal health reform includes in the Senate bill as it was passed by the Senate on Christmas Eve are interstate compacts. California would have to consent actively, this legislature and the governor, to enter into one of those. So somewhat different than perhaps the impression that was left.
Thank you. Next.
Madam Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, also here in opposition. I would concur with the comments made by my colleague, Ms. Capel. We're very concerned about the loss of protections that this legislature has deemed important for Californians to have. Some of them, I would argue, are somewhat unique to California. We have some of the strongest protections, for example, for limited English proficient consumers. California deemed that critical for our population here in California, and we agree that that is critical. In terms of the race to the bottom, we're very concerned about this aspect for low-income consumers who, it is devastating to see how someone can spend hundreds of dollars a month in premiums and get a really lack of quality health insurance, and we're very concerned that that would increase should this bill come to pass. I also want to spend a minute looking at the chaos that would ensue in terms of the regulatory framework of licensing health insurance products. The analysis does a good job of pointing this out. It's hard to see right now in California. There's the Department of Managed Health Care, which regulates HMOs, and the Department of Insurance, which regulates most PPOs. Presumably, if I have bought a product in North Carolina, I would have to call the North Carolina Department of Insurance. They may or may not be willing to take my call. They may or may not view that they have jurisdiction. So I'm very concerned. The Knox-Keene Act does a good job of laying out an appeals and grievances procedure for consumers who have problems with their health plans, and passing a bill such as this would put that entire framework into chaos. So we urge your no vote. Thank you.
Thank you. Before I call on Senator Cox, who has a question, is there anyone else who wanted to come up and say they are in support? All right. Senator Cox, you had a comment or question?
I do, yes, ma'am. Based upon,
pardon me?
Maybe I misunderstood, and it was just triggered by what was said. Senator Senator Huff, you're not talking about repealing any mandates, are you?
No, sir.
So this would, and assuming that you could work out that the states could work out the details, this would only give consumers the chance to buy the insurance that they want?
Correct.
So I'm kind of confused, Ms. Capel, as to what you were talking about.
Senator Cox, I think this legislature and a number of governors, including Governor Pete Wilson, who signed more benefit mandates than any other governor in my recollection, have made the choice to provide these protections to Californians. And so we believe that that's what we have decided as a state are the protections that Californians should have to allow out-of-state carriers who do not have to comply with California requirements to sell in California undoes those decisions of this legislature and of a number of governors.
Ms. Capel, you're not saying this bill says that it eliminates mandates, are you?
No, sir. I'm saying that it allows insurers who do not have to comply with California law to sell in California, which is what I understand this bill to do.
And let me just close by asking, so then what you're talking about is giving the consumer the opportunity to make a decision that they want to make?
Sir, this legislature and the governor and various governors have made a decision that there should be basic standards for health insurance in California. This bill undoes that.
I don't know that it does. That's what I'm trying to figure out, because what I've heard you say was that it gets rid of the mandates. I don't read that. I don't find it in this bill.
But, Senator, with due respect, it states that these products would be exempt from all other provisions of the Knox-Keene Act and the insurance code governing health insurers.
Okay, so point on this, I think it's fair to say that there is no mandate, but what the bill does is by allowing out-of-state carriers to offer products where they do not have to have the consumer protection or the government oversight, there will be products sold to California residents that do not have the consumer protections or government oversight. And we know that California residents want California standards in this area. Is that a fair statement? Okay. Senator Cox, did you have a follow-up?
Well, I just want to, does this bill already determine now, it doesn't get rid of any mandates, but it is covered by ERISA, correct?
Correct.
Tell us what ERISA does. Does it apply to all insurance products in the 50 states?
It does, and in fact, in California, it is the default law governing 50 to 60% of the health plans being provided by Business Now.
Does it also include the self-insured market?
Yes.
That would be a company like Safeway.
Exactly.
That would be a company like, well, a couple more. I can't think of this.
But Safeway is a very good example. It's a large company. They've done a good job with it, and it's ERISA that is the guiding principles that they have crafted their coverage by.
Madam Chair, thank you very much. I just wanted to make I suspect Senator Huff was swimming uphill like I was, and just trying to give him a little relief, but to say to you that this doesn't eliminate any mandates. That's all. And to say that it does, it doesn't.
Thank you, Senator Cox.
You're welcome, ma'am.
Senator Onstad. Anyone else who wants to speak?
I guess I would reiterate that point. I had written my note to myself, why is the opposition assuming the loss of these protections? Are you saying that the people in Texas aren't protected by companies in their state? People in Illinois don't have those similar protections? Maybe not quite the highest level that you would like to see, but enough so that consumer choice has said that that's what they want.
If I may, Madam Chair. I think as Senator Huff illustrated, in other states there are fewer protections. We find that problematic.
One of my staff met with a union carpenter this weekend. Let me give you a hypothetical. He is paid a base wage of $29.27 an hour in and then gets non-wage benefits that equal to $20.96 an hour. Those include health benefits, retirement, et cetera, dental. This $21 an hour is money that the carpenter never sees. Now, if he had the option to find a more competitive health care, and we were able to do that on the internet so that his hourly cost was $6.50 an hour rather than $20.96 an hour, it leaves about $14 an hour that he could negotiate on the negotiating table to take home and increase his salary with the same level of insurance coverage. What is wrong with that?
Senator Anistad, I'm sure that his union, in negotiations with their management partners, have gone through all of those numbers. I don't know the specifics. It would surprise me if the differential were as great as you suggest. As you note, retirement is an important part of this, as well as retiree health, which is often important to our friends in the building trades. This bill is about taking away the protections Californians have today. That's the point of it.
Okay.
It is not clear to us.
I would differ with you, Beth. This is not what that bill is. This bill, first of all, the data that I used came from the labor union itself. And second, this bill is about consumer choice and about lowering the cost of health care in California, which is something we're all trying to do.
We would be delighted to join with you in an effort to reduce the costs to small business and to individuals and to large business. We think the costs are very problematic.
Thank you. We've heard you both. Senator Cedillo.
I'd like us to vote on the bill. I think it's very evident. We've heard that there was no dispute that for 20 years we've had the lowest prices, and it was reaffirmed by direct questioning that we have the lowest prices. So we have a pretty good choice when you compare us around the country. ERISA is a baseline standard, and that's fine, and that's good. But there's nobody here who's going to argue that it's as robust or as rigorous as the standards that we have in California. And so some of us would prefer that we had lesser standards. That's fine. But here in California, we have high standards in a lot of work protections and consumer standards and environmental standards, and that's why so many people come here. And so I think it's very clear what the options are in front of us. By omission, not explicitly, but by omission, the failure to state affirmatively that the standards would be the same as California, when we know that ERISA is the baseline and not the high standards of California. By omission, if you permit another product to enter the market that does not have explicitly those standards, then by omission you are indicating that you could sell a product with a lesser standard. And in California, we've made a choice not to do that. I ask that we move the bill for a vote.
Madam Chair, can I get the last word in?
Yes, we will move the bill in a moment.
Thank you. I just want to point out that there's a similar bill that was introduced in the House of Representatives back in 2005. It was H.R. 2355, and it would have allowed individuals buying health insurance in the individual market to do so out of state. And the Congressional Budget Office estimated about 1 million small group enrollees would lose health insurance coverage as a result. Now, low-risk purchasers would get into the market because they would buy these cheaper policies, but the higher risk are the ones who would get dropped. And that is not from me, but that's from the Congressional Budget Office, and I think it's a very important point that needs to be made.
Thank you. And the point that I would like to make is that we have worked and fought very hard here in California for the right of independent medical review, the right to a second opinion, and the right to sue an HMO. And how do you put that in dollars? I mean, we're talking about saving people's lives. And many years ago, way before I was chair of Senate Health Committee, I remember people come up and saying how their spouse died or whatever because they never had a chance to see the right person to have the correct kind of operation. And we understand, many of us understand, that these are rights Californians expect to have. We have these kinds of health standards. And for this reason, I will be in opposition to the bill. Senator Cedillo chooses to move the bill.
May I
And
close?
Senator Huff, would you like to briefly close?
Yes, thank you. Let me address some of the things that were said. ERISA keeps coming up, and by the way, I'd be happy to write ERISA into the bill. It's already federal law, and has been stated, that is the floor. And if you think Safeway has a bad health plan, then maybe you won't like this. But again, 50 to 60% of the state businesses are already providing ERISA-based health plans to their employees. I'm willing to work with the health underwriters. I think they made some good points. As this thing moves through, it is tagged fiscal, so this isn't the final line, unless, of course, you make it that way. There is, frankly, a high rate of uninsured. And to the degree that you do save money, we're not the lowest in cost in health insurance, incidentally. We average lower, I believe is what he said. There was an analysis done in a previous version of this bill that said if you took insurance being sold in Utah, and that was what was being offered here, it would save our consumers a little over 10%. Now, for some businesses, that's not a big deal. For other businesses, that's a huge deal. For the chronically uninsured, the invincible that believe they don't need something, maybe they're more able to afford this. So I don't know that we necessarily have to say that it's going to drive the low risk will get in, the high risk will get out. I'm not sure what the data was that was built upon. I do know that on the federal level, President Obama has said he's proposed an insurance exchange to allow insurers to compete in cost-effective ways. And here's a quote from him: "We need, quote, a market where Americans can one-stop shop for a health care plan, compare benefits and prices, and choose a plan that's best for them in the same way the members of Congress and their families can." And this is a component of that. It's opening it up for people that may not be of an age where they have to worry about prostate exams or things like that are covered, but give them the opportunity, educate them and give them the opportunity to choose a product that makes sense to them. And some of this comes back down to just a different role of government. Some have called it government oversight or consumer protection. Not everybody wants to be protected or overseen quite to that level, and this would provide markets for them. This isn't for everybody. It's another alternative. It's another cost-effective alternative that can save businesses money and therefore save jobs. And those are the reasons I'm bringing this to you, and I would ask for your aye vote.
Thank you, Senator Huff. Let's call for the vote.
Alquist?
No.
Alquist, no. Strickland? Honested? Aye. Honested, aye. Cedillo? No. Cedillo, no. Cox? Aye. Cox, aye. Leno? No. Leno, no. Negretti McLeod? Pavley? No. Pavley, no. Romero? No. Romero, no.
Chair, who made the motion to...
Cedillo.
Senator Cedillo.
Cedillo did. Who made the motion to pass the bill out?
Yeah. No, he made...
No, he just made the motion to call for the vote.
For a vote.
Oh,
He did not say he was in support of the bill. The vote was 2 to 5. The bill's defeated. Meeting adjourned.